Hi, this is Dr. Raghuram here. I'm practicing diabetologist and physician at Kanwa Diagnostic Center, Rajajinagar, and Vaishnavi Heart Center at BTM Layout, Bangalore. So today I have come up with a very important discussion topic on heart disease and diabetes. You know, many people suffering from diabetes as well as heart disease. So to me also, this is a very important topic. The people should know about it, how to prevent heart disease when people are already having diabetes. So as you know, like diabetes is a disease where the blood sugar keeps on increasing. So the primary problem here is after taking some food, your body, particularly the pancreas, will not be able to secrete enough insulin so that blood sugar increase is checked. So either the insulin secretion is less or the insulin action is less. So that's how your blood sugar keeps on increasing. You look at the other important disease, that is heart disease. What we mean by heart disease is primarily it deals with two or three things. One is ischemic heart disease, the other is heart failure, and so many other conditions associated with hypertension or other diseases. So when you talk about ischemic heart disease, basically here we are talking about an atherosclerosis causing a blockage to the artery. So basically we have three blood vessels supplying to the heart. One of them could be blocked, or two or all the three can be blocked. So if all the three are blocked, the disease is more severe. Or if the blockage itself is more severe, more than 80-90%, then also it is severe. So we need to know about these two diseases. And unfortunately, if you look at the diabetic population, how they die, so nearly 50% of them die because of a heart disease. So that means if you want to prevent rather or postpone the death in a type 2 diabetic patients, you need to target the ischemic heart disease. Also, you need to target the heart failure, which is very important condition in type 2 diabetes. So you need to know both these conditions. And as you can realize, the mortality in type 2 diabetes is more if you have an ischemic heart disease or heart failure. So it's almost the double. Similarly, the stroke events are also more in uncontrolled diabetes. So these are the primary two causes of death in type 2 diabetes. So we must need to remember and try to identify these risk factors in type 2 diabetes. Please go through the tests and some of the symptoms which can lead to this heart failure or an ischemic heart disease, and discuss with them with the doctor, and they will give you good suggestion to control these two disease. So remember, the diabetes is a lifestyle disease. It is a chronic progressive metabolic condition, so it doesn't stop. Actually, if you have got a diabetes in 2020 and if you're looking now in 2021, it has already progressed by an year. So there is a progressive loss of beta cell function producing the insulin. So there is you need to keep on checking the blood sugar at regular intervals to make sure that the drugs which you are taking are working well, you are reaching the targets of HbA1c which we are going to put, and try to maintain good glycemic control, and all other risk factor modification you need to do. So now let us look at once we realize that we need to prevent the ischemic heart disease and the heart failure in type 2 diabetes, we need to also look at how to prevent them. So first and foremost is know your ABC of diabetes. What I mean by ABC, A is A1C. A1C is a blood value that will give an average glucose over the last 90 days. So most of the type 2 diabetic patients whom we see, we need to keep this target of HbA1c below 7%. So if you can maintain your HbA1c value below 7%, most of the times you can prevent all long-term complications of type 2 diabetes. What are those complications? Remember, the eye disease, what we call as retinopathy, the kidney disease, what we call as chronic kidney disease, or the nerve damage, what we call as neuropathy. These three primary things are because of long-term uncontrolled diabetes. So you can prevent them by having a good HbA1c control to the target of less than 7%. And other important complications are heart disease and stroke. So these are what we call as macrovascular disease. Many a times it is tough to control them, for which you need to look at all other risk factors also. So the ABC which I wanted to tell is A is A1C, the B is blood pressure. Very, very important risk factor. If you have hypertension and diabetes, your risk for heart disease will shoot up significantly. It is exponentially more. So the risk becomes double, triple like that. So you need to control the BP to the target of less than 140/90 in most of the people. And if you're comfortable, still we can aim it to less than 130/80 in most of our patients with type 2 diabetes. Next, C is cholesterol. So you need to look at your cholesterol. There are two important things. One is the total cholesterol, the other is the bad and the good cholesterol. So the LDL, what we generally say, is the bad cholesterol, the HDL is the good cholesterol. So when you do a lipid profile test, you need to look at them and try to keep this LDL cholesterol below 100 as far as possible in type 2 diabetes. If you can do that, either through the dietary intervention, exercise, as well as with the help of medicines called statins, you will find that the blood vessels are not blocked. Ultimately, you need to realize that the cholesterol is the one that blocks the blood vessels. So if you have low cholesterol, there is less chance of atherosclerosis blocking the heart blood vessels as well as the brain blood vessels. So you are likely to prevent both heart attack and stroke. So this is the ABC you must know. So the next important thing is look at other risk factors you are carrying. Very important is obesity. Obesity is a major driver for the complications of type 2 diabetes. So you need to cut down the weight. How do we do that? See, so for example, somebody is too much have weight, and if I say you need to cut down by 30-40 kgs, it would be very difficult to follow. So what I would advise in most of the type 2 diabetic patients is try to lose the weight by at least 5% from the baseline what you have. So if you can achieve 5% weight loss, most of the times you can get the metabolic benefits. Your glycemic control will become very good. And if you achieve 10% weight loss, probably other risk factors for the heart, everything will come down. So weight control is an essential thing. Next is, of course, control of diabetes, which I already told, and other risk factors, very important, the smoking and alcohol, you need to quit. And sometimes you will have some non-traditional risk factors like a family history of heart disease, an unrecognized risk factor, but very important. If somebody in your family has died at the age of 30 years, 40 years because of heart disease, you do carry a lot of risk for a similar heart attack or a stroke. So a strong family history of premature cardiovascular disease you must consult the doctor immediately and try to ascertain what else risk factor you have, for example, cholesterol and uncontrolled diabetes and hypertension, obesity, like that. You need to look at and treat it more aggressively in such individuals who have a family history of premature cardiovascular disease. So this one thing I wanted to make it very clear. And other common thing we come across nowadays in our society is the stress factor. We do have a lot of stress factor. So we must make sure that we have adequate sleep, at least sleep for 7 to 8 hours each day. Relax yourself with yoga or some other exercise which you feel comfortable with you, and try to drink plenty of water, fruits and vegetables. All these things will do a lot good in you. And talking about the diet, which is a very important risk factor thing we need to know. So what I would advise in most of the patients is in a plate concept. What we advise, a healthy plate, half of the plate you try to keep the vegetables and fruits. Very simple. You cut some raw vegetables, keep 2 cups of them, and another 2 cups cooked vegetables, and 1 cup of fruits, cut fruits. So that should fill half of your plate. And 1/4 of the plate you try to keep the protein portion, which we commonly advocate with the dal, nuts, curds. If you're comfortable, you can put an egg also there, and that should constitute the protein portion, the 1/4 of the plate. And another 1/4 of the plate should be carbohydrates. It could be a small 2 chapatis, maybe, or a small cup of rice, or even a small ragi ball. So basically the carbohydrate portion should be 1/4, protein portion should be 1/4, half of the plate should be fiber. The fiber we are getting through the vegetables and the fruits. This is what we call as a healthy plate. This plate will help in controlling not only the diabetes, it also controls the hypertension, it also controls the risk factor for heart disease. It also controls or rather reduces the risk of cancers even. So it is basically a healthy plate for the prevention of all these diseases. So you need to employ this very simple strategy, but very effective. Also remember that when you have more cholesterol, so you need to cut down the saturated fats. Many a times the food which we eat outside are all rich in saturated fats that you need to cut down. Like for example, vanaspati oil or ghee, butter, these things you need to move away from this and try to move more unsaturated fats like sunflower oil or a rice bran oil, like that. So naturally you will have a better food. And eating at the right time, the right amount is also important. And having adequate sleep, in nutshell, if you put, it becomes a healthy lifestyle. That's what is required. So to control diabetes, to control the heart disease, to control hypertension, to control cholesterol, you need to employ this healthy plate concept. And regarding exercise, very important preventive step, I would just give one or two important tips. Make sure that you do exercise every day. So you should not take a break more than 2 days in a week. So if you take break more than 2 days, the benefit of exercise will come down. So I would advocate everyone to do at least 30 minutes every day of at least basic walking, brisk walking. That's all is required every day. If you can do, you will cross minimum 150 minutes per week, and that will keep your heart also healthy, your diabetes under control, your hypertension under control, cholesterol also under control. So you're going to prevent so many diseases. So exercise is a critical factor. So you need to have a healthy diet, you need to exercise regularly, you need to quit smoking and drinking, you need to control your diabetes. Remember the A1C target of less than 7%, the BP target of less than 140/90 or even less than 130/18 most of the people, and cholesterol control LDL less than 100. If you can do all these things and have a regular follow-up with your doctor, you can certainly prevent the heart disease. And if this message encourages all of you to do this healthy lifestyle management, I would be very happy. And with this, I'll sign off. And I hope we can prevent this heart disease and beat this heart disease in type 2 diabetes. We can prevent type 2 diabetes. Just follow these simple steps. Thank you.